Welcome to week 7. We are covering chapter 9, weight management. The overweight and obesity crisis in America. Over two-thirds of American adults are overweight. About half are at risk for a category of obese. As you remember, we have three different categories that we covered previously. So the WHO estimates that 2.2 billion people are overweight or obese. Many studies have confirmed that obesity and the lesser extent overweight shortens lives. So this is just a chart, an easy chart to look at. So we have risk of death on this side and then maximum BMI. And as you can see, if you're in the normal or overweight range, it's not as high of a risk as obesity in class 1 or class 2. And you can imagine class 3 will be somewhere around here. As you can see, the more BMI that you have, the higher risk of death that you have. And that's because overweight and um, obesity causes a lot of health issues that relate to death. Obesity is one of 6 major controllable risk factors for heart disease. So, we have talked about cardiovascular diseases before. We could have hypertension. There's different types of cancers, gallbladder diseases, kidney diseases, respiratory problems, joint diseases, skin problems, impaired immune function, and sleep disorders. So think about this. If it's much easier for a person who is in the normal range of BMI to exercise, to sleep, to eat a healthier diet because they are not already feeling worse about themselves in comparison to somebody who is overweight or obese. Knowing that there's so many different factors that could occur to you is just terrifying. So nearly 90% of people with type 2 diabetes are overweight when diagnosed. A weight loss of just 5 to 10% in obese individuals can reduce the risk of a weight-related health conditions and increase life expectancy. So as you remember from the start, the more BMI that you have, if you were in class 2 or 3 and you went to class 1, you can already see how the risk of death decreases if you're looking at in the opposite way. And the more that you lose and you go into maybe overweight or normal, the risk are slowly and slowly are decreasing. So even though somebody is obese or overweight, it's not the end of um, it all. They just need to focus on weight loss and healthy eating habits so that way they can really improve their life expectancy. So the difference between overweight and obese, we have talked about this before. 25 to 29.9 is overweight, which is a proportional weight to height, and obesity is an index over 30 or more. And there's 3 different classes of obesity. So as we talked about before, body mass index, we call it BMI, is just a measure of body weight that is useful to estimate person's weight status and for classifying health risk of body weight. So it's helpful when sophisticated methods are not available. If you remember the BII and then DEXA, all of those will be greater predictors of your current state of weight. But this is a very useful kind of an estimate of where you are. So BMI is less accurate for those 5 feet tall and older adults and certain other groups. It's calculated by dividing weight in kilograms by the square of height, which you believe did for your other assignment. So BMI is combined with waist measurement to more accurately assess the health risk. Waist measurement help provides an estimate of body fat distribution. As remember, there's visceral fat, which is around your major organs, and subcutaneous fat, which is under the skin. And you have seen this previously of underweight is under 18.5 and extreme obesity is 40 plus. So people always ask, how do I get to be my weight? Energy balance model. It will describe some of it. There's different types of models that we will cover. So energy balance is a condition that occurs when energy intake equals energy expenditure. The key to achieving and maintaining a healthy body weight. So if you are going for a hike and you eat 3,000 calories, that is okay because most likely on your hike you will burn it out. But if you're eating 3,000 calories and plan to sit watching TV all day, that is an imbalance. So there will be more fat storage than if you were going for an intense exercise. So, a neutral energy balance, you expend the same amount of energy that you take in. So, this is where your weight is constant. A positive energy balance, you take in more calories and then you expand and promote weight gain. A negative energy balance is when you spend more calories that you take in and promotes weight loss. So, think of these as you are staying at the same weight, which is neutral. A positive is you're gaining weight, and negative, you're losing weight. So, a carbohydrate insulin model. We have talked about carbs and insulin before, so this shouldn't be too difficult to understand. So, in this model, the primary cause of obesity is overeating refined carbs, which triggers an insulin response. So, if you look at a typical American diet, there's a lot more carbs than anything else in our diet. So, it's easy to understand how we can overload on carbs. So the calories get trapped inside the fat cells, fewer calories remain available in the bloodstream, leading to feelings of hunger and overeating. And then insulin stimulates fat tissues to absorb glucose and also decreases the release of fatty acids from fat cells. It inhibits production of ketones and promotes fat and glycogen deposition. So the problem is the wrong kind of calories, which leads to an expansion of fat tissue. So if you were eating good carbs or eating something healthier, it wouldn't be so much of an issue in this model. So we'll talk about other models. So multi-factor model. A third model suggests obesity is a multifaceted problem. So we have genetic factors, which influence body size and shape and fat distribution, metabolic rate, and the tendency to gain weight comes from your genes. Set point theory suggests our bodies maintain a generally stable weight in a narrow range. At the rate at which our body burns calories adjusts according to how much we eat. Our set point can change, but physiological factors may make it easier to maintain a higher rather than lower set point. So, fat cells. Some people are born with an above average number of fat cells and thus have potential to store more body fat. Overeating at critical times can also create more fat cells. Fat tissue sends out chemical signals to replenish, affecting multiple organs and systems. So, really think about it. Not everybody's body is created equal, but you are able to take control of your genetics by healthy eating and physical activity. So, metabolism. I'm sure you guys are aware metabolism is just the process of which food, energy, and nutrients are made available to you and used by the body. So, we have a resting metabolic rate, which is the energy required in calories to maintain your vital body functions while the body is at rest, including respiration, heart rate, body temperature, and blood pressure. So we've talked about the in our picture from a couple of weeks ago with the men and women and showing you how we need different energies requirements for each of us. So genetics affect metabolic rate and a number of factors to reduce metabolic rate, adding the challenge of weight management. Exercise can have a modest effect on RMR. So this is where does the food energy go? So 20 to 30% is in physical activity, 10% in food digestion, resting metabolic metabolism is 65 to 70%. Also, in the multi-factor model, there's hormones and gut microbiota. So hormones can change at puberty, during pregnancy, at menopause, which contribute an location of fat accumulation in women. And other hormones linked to obesity are insulin, leptin, and ghrelin, which we have not talked about. Um, then we have the gut microbiota, which is just the bacteria in human intestines help digest the food you eat. Studies have shown lean people differ from overweight people in the composition of their intestinal flora, suggesting that intestinal flora may be involved in obesity. So, in lean people, think about that they have more efficient maybe bacteria versus somebody who is obese. It might just not be as efficient, and that's how they differ. So, also, psychology, culture, and behavior fall into the multi-factor model. We have many people use food as means of coping with stress and negative emotions. We have binge eating, which is just a pattern of eating so much food in uninterrupted episodes of high consumption. So you had a really bad grade, or somebody said something to you, and you just go and eat 4,000 calories in an hour. Obesity is a strong association with socioeconomic status. The prevalence goes down as family income levels go up. So, this may reflect the differential access of healthy foods. So, you might think, how many grocery stores are near my house? That might tell you um, what is the predominant population in your community of obese versus normal, because grocery stores dictate a lot of those in recent studies. And it also reflects cultural differences in acceptance of larger body types. Food is often an integral part of social gatherings. Sleep. So, if you have short sleep duration, sleep depth are associated with increased BMI, abdominal obesity. So, when you're sleeping, you actually are burning off calories, and a lot of good things are happening when you're sleeping for your body. So, if you're not getting enough sleep, that really disturbs that cycle. And food marketing and public policy. So, food marketing and pricing, food production, distribution system, and national agriculture policies all impact our food choices. So, where we live and work in obesogenic, encouraging overconsumption of calories and discouraging physical activity. Low income neighborhoods often have only fast food menus. Public policies can be used to promote healthier choices. So, it really is correlated with SES, because if you live in an affluent area, there is going to be more healthy choices, healthy restaurants, and healthy grocery stores in comparison to somebody with low SES. So, physical activity and exercise is very, very important for obesity, as we've talked about before. If you remember, we have 150 to 300 minutes per week. Sometimes wouldn't exactly lead to a weight loss, but it might maintain. And then 16 to 90 minutes per day, every day, will help you decrease your weight. For people trying to lose weight, increased activity is generally less important than reducing calorie intake. A combination of exercise and diet yields the best results. So there's also very different diet plans that people are trying to sell you on. So combination of healthy eating and um, adequate exercise really could help. So this is the effects of diet. exercise in combination of diet and exercise and weight loss. As you can see over here, we have weight loss. And so if you're just in control, not much weight loss is happening. Exercise only, as you can see, it's only 5. And diet only has the biggest out of the other two, but diet and exercise is the highest. So as you can see, the most important is really you can't just exercise and not fix your diet. You have to fix your diet and also improve on your exercise. Physical activity is especially important for weight loss maintenance. The body tends to compensate for weight loss by reducing RMR and increasing hunger signals. So people who have successfully maintained weight loss over time engage in high levels of physical activity. When people exercise, they slightly increase their RMR. Moderate intensity exercise can burn a significant number of calories, translating to less calorie restriction to maintain energy balance and weight loss. So, physical activity is just very, very important. Prescription drugs for obesity, there's plenty that anytime you turn on your television, there will be something for obesity. So some are approved only for short-term use. Most experts agree they must be safe over long term to be effective for treatment of obesity. And there is also crazy side effects. Prescription medication works best in conjunction with behavior modification. So that's your healthy eating and your exercise. Surgery, about 7.7% of adults in American ages 20 and over are severely or morbidly obese with a BMI greater than 40. So surgical intervention, known as bariatric surgery, may be necessary as treatment of last resort. So I won't think about the surgery as the last possible that you have tried to exercise, eat right, and you just still can't lose the weight. It may be recommended for a BMI greater than 40 or a BMI greater than 35 with obese related illness. The surgery modifies the gastrointestinal tract and carries numerous risks. Weight loss is 40 to 70% of total body weight over a year. Liposuction involves the removal of small amount of fat from the specific location and is not treatment for obesity. So gaining weight. Just as for losing weight, a program for weight gain should be gradual and include both exercise and dietary changes. The foundation of successful and healthy program is a combination of strength training and diet. In most cases, a high carbs, high protein diet also contains healthy fats. Energy balance is important. So there are many instances where weight gain is needed for people with many disorders that we will talk about next. Eating disorders, a serious disturbance of eating patterns or eating related behavior characterized by negative body image and concerns about body weight or body fat. In the US, about 20 million women and 10 million men suffer from eating disorders sometime in their lives. Eating disorders are classified as mental disorders. So we have different types of eating disorders. We have anorexia nervosa, an eating disorder categorized by refusal to maintain body weight at minimally healthy level and intense fear of gaining weight or becoming fat, self-starvation. So if you remember, our body needs a certain amount of calories to really maintain it, and these people are doing it below the average of need. And then we have bulimia nervosa, which is recurrent episodes of binge eating and then purging to prevent weight gain. So these people are very afraid of weight gain. And so purging, there use vomiting, laxative, excessive exercise, restrict dieting, anemias, diuretics, or diet pills compensate for food that has been eaten that the person fears will produce weight gain. So we have binge eating disorder. This is the binge eating large amounts of food in a short period of time. Episodes are marked by feelings of lack of control. It does not involve compensatory purging behaviors. Binge eaters are almost always obese. So, a binge eating they is just a way of a coping mechanism. There's also other specified feeding or eating disorder